you've heard, my name is Dr. Dulcie Wanda. I'm an oncologist by profession. I work with the Nakuru County Referral Hospital in the oncology department. I'm very pleased to be here today because advocacy is one of the things I'm very passionate about, because I believe knowledge is power. And when we have knowledge concerning cancer, one, we can remove some of the myths that are there. We can remove some of the fear that comes with the diagnosis of cancer, and we can generally have a way forward. So I don't know, have you been able to find the presentation? Maybe I need to help her. Just give me a minute. Okay, I think we are set now. So we wanted to begin with a bit of statistics. That's why I want the presentation up. Are you able to project? So when we talk about the cancer statistics, please. Sorry? All right. So for some reason, we're not able to see the statistics, but if we look at the statistics in Kenya, then breast cancer stands as number 1 of the cancers. Number 2 is prostate cancer, and then we have cervical cancer, and then colorectal cancer. That's really an important statistic, just to tell us when we talk about screening, which cancers should we screen for. So for women, like we mentioned, cancer of the breast is number 1, followed by cancer of the cervix, followed by cancer of the esophagus. For men, cancer number 1 is cancer of the prostate, followed by cancer of the colorectum, and then cancer of the esophagus. That is a significant difference from what the West has. In the West, they have cancer of the esophagus not being very high among the charts. That's to tell us if you're having heartburn for more than 2 weeks, it's important for you to go for screening, because it may mean that you actually are at risk of having esophageal cancer. If for you to swallow a meal, you must have a glass of water in front of you, such that you chew and then take some water, meaning swallowing is a problem, then that could mean there is actually some dysphagia. You're having challenges swallowing, which could tell us there could be some obstruction and we need to do an endoscopy. So I've heard people talk about mimi ninakuwa na shida ya ulcer. Sometimes we own some of these conditions. However, if you've had ulcers or heartburn for more than 2 weeks, it is recommended that we do what is called endoscopy to confirm why are you having that hyperacidity. For women, breast cancer is number 1 in our charts. That means it's very important for us to ensure we go for screening. So 1, if you're below the age of 40, we really would like you to have screening for the breast, which we can do as a clinical breast examination, or we can be able to do an ultrasound if there is a finding that is found. For someone who is above the age of 40, then we recommend a mammogram. So if we look at the data, it talks about 7 women every day succumb to breast cancer, and that's why we are talking about it today. And it accounts to over more than 3,000 deaths, and it's the second leading cause of cancer deaths in the country. So if we look at that statistics and say 7 women die every day because of breast cancer, it helps us see the importance of us be able moving forward. So when we talk about what cancer is, so normal cells in the body undergo division. So a cell will grow, divide, and eventually die off. So if you look at the screen there, you're able to see that there is an area. I don't know whether you'll be able to see what I'm saying. If you look here, there are 3 cells that are not normal. They look red in color, and eventually they can multiply and form a tumor. And later, this is what we call a malignant tumor, which is able to pass through the layer of obstruction, which we call the basement membrane. And it's possible for these to go into tissue and even go into blood vessels. And that's basically what cancer is. A normal cell that has stopped dividing normally and now is replicating and not dying off as we expect. And that's also just a diagram to say the same thing. If you look at the top image, then we're talking about these being normal cells. This one in red is abnormal, and then it gives birth to a whole team of cells that are abnormal. And that's what we mean. That's what cancer is. So when we talk about types of cancer, there are very many types of cancer. Actually, you can get cancer from anywhere. Every cell in your body can get cancer except your nails, the outer part of your teeth, and your hair. Otherwise, every single part of your body can get cancer. And we name the different cancers based on where they come from. So you can hear of tumors called sarcomas. You can hear of leukemias, which are cancer of the blood. That's an image to show how the tumor can be able to grow. We have a collection of, there you see, there is a primary tumor that enters into the blood cell and can go to another organ. If you look at it, when it enters the other organ, it becomes a tumor. And that's why if you had a tumor that maybe started in the breast, you can find it later in the lungs, in the brain, in bone, and even in the liver. That's just to show how cancer cells can be able to move. So what is a risk factor? There are many risk factors to cancer, but having a risk factor does not mean you will definitely get cancer. No, it just means it increases your likelihood of getting cancer. So, sorry, the screen went off. So when we talk about risk factors, there are several risk factors, and they are classified in different classifications. If you look at the first classification, we're talking about biomedical factors. These are factors you can't change. For example, your genetics. So if I have had a family member, either a mother, a father, a grandmother, we talk about mostly the nuclear family, having had cancer, then I am at risk of cancer. I can't change my family. The second one is hormonal factors. For breast cancer, the cancer we talked of being number one, being female is a risk factor, because we know, and we can't change our gender. Men also get breast cancer. The percentage is low. But it is good for men to note they can get breast cancer. And when breast cancer happens in men, it is more aggressive than in women. The other risk factors is the lifestyle. There are certain things people indulge in that put them at risk. And it's nice to talk to people who love the Lord, because then some of these risk factors are things we will not be exposed to. For example, cigarette smoking, alcohol consumption. The last three, we might be at risk. So one is physical inactivity and obesity, and that's a risk factor to cancer of the kidney or esophagus, colon cancer, especially in males, breast cancer in females, and cancer of the endometrium. The other one is chronic infections. If you have a chronic infection with the human papilloma virus, you're at risk of getting cancer of the cervix. If you have continuous infection with hepatitis, then you're at risk of getting liver cancer. And then the last one is diet. There are certain diets, for example, that are rich in animal proteins that put you at risk of getting cancer of the bowel, breast, and prostate. And then the last category is environmental factors. Here we're talking about risk factors such as sunlight, radiation, occupational exposure, and also pollution. So this slide really just tells us we have a role to play in the risk factors. The next slide just talks about the contribution each has. Sorry, the slides are not moving. Yeah, so that just shows the contribution each can have. So for example, if I have obesity and I am not exercising, then my risk is 35% of getting cancers. If I add that to infections, that's another 7%. Exposure to environmental factors is another 10. Just as to show it can be cumulative. The more exposure you have, the more the risk factors, the higher the risk of getting the cancers. All right, so we'll discuss the cancer that is highest in men, and this one will talk about cancer of the prostate. We will discuss a bit about it because in our population, in the African American population, cancer of the prostate is very aggressive. So when we talk about it, we look at the age. We are talking the age being the strongest risk factor. So being the age of above 45, the older you are, the higher the risk of getting cancer of the prostate. If you've had a family history, your father, your uncle, your grandfather had prostate cancer, that is also a risk factor. I've mentioned the fact that we're African American, the fact that our skin color is black is a risk factor. And then we normally, if you've had prostate changes, maybe your prostate enlarged and at some point we looked at it and we saw it was abnormal, that's a risk factor. And finally, the diet, the food that you're able to take. For example, if you're taking a food that is high in animal fat, low in fruits and low in vegetables. Majority of men don't like a lot of vegetables, so this should be one of the motivators to take vegetables, because the higher the vegetables you take, then the less the risk. So that is just to show us the anatomy. So this area, this is the bladder. This is what keeps the urine. These are the ureters. Up is where you expect the kidneys. So at the base of the bladder, this is where you find the prostate gland. And this is the urethra. So urine passes in a channel through the prostate gland. So when there is a tumor, you can see this channel where urine passes through is quite open, and this other one is quite closed. So it means this patient would have challenges in passing urine. And that would be one of the early symptoms that there is a problem in passing urine. And that's what happens. When someone tries to pass urine, if they have an enlarged, the prostate is okay, the urine just flows out. But in this other one, you find the urine circulating, because when it tries to go on, there is a compression. So one would feel like you've gone to the washroom, yes, you've voided, but you've not completed, because some of it is circulating, as opposed to all of it passing through. And that's a risk factor. That can tell us there's a problem. So there are many signs and symptoms. We've mentioned the urine. For example, noticing before you could urinate very far, over time it's coming closer to you. You have to push harder to be able to pass urine. All those are signs that you could be having prostate cancer. Other signs that are there, like one in bold, it's talking about erectile dysfunction. I think this is something men are not very able to discuss, including blood in semen, increased frequency in urinating. Erectile dysfunction means you're not able to sustain having sexual relations for a long time. So that means previously you would go maybe for a longer time, but you're noticing a reduction in that. Most men don't talk about it, but it could be one of the very early signs that you're having prostate cancer. Having pain in the lower back, loss of weight, and even loss of appetite is part of what can happen. So how can we prevent? There are some things we talked about that we can do something about, because it is exposure you expose yourself to. There's the diet bit. It has been shown that if you take diet that is rich in vegetables and fresh fruits, it's good. If you're exercising and you're maintaining a good weight, you're managing your stress, or you avoid totally smoking and drinking alcohol, those are good ways to avoid getting cancer. The next cancer we're going to talk about is cancer of the colon. We mentioned it's number 3 in the charts, especially in men. So it's good to note, what is cancer of the colon? So the diagram in the middle just tells us what the colon is. This is what the colon is. So food, after digestion in the small intestines, enters the large intestines, it's passed through and comes out as feces. So one of the risk factors to colon cancer is being male. So if you're a male, you have a higher risk of getting colon cancer than a woman. 2, if you're elderly, if you smoke, if you're eating a lot of processed meat, alcohol, you're not taking a lot of vegetables, you have high body fat and obesity, genetics, part of your family members have had colon cancer, it's a risk factor. And then if you're diabetic, that is also another risk factor to colon cancer. So what are some of the symptoms? One of the symptoms, number one, is rectal bleeding. So you go for a long haul and you notice blood, and it is painless. There is no pain associated. So if you don't check, you might not realize. So if you notice blood in stool that is painless, it's important to get it checked. You notice a change in bowel habits. Maybe you'd go every day, now you're going once in 3 days, or you're going more frequently than what you used to know. We need to get that checked. And then if you're feeling that you're full, you need to pass stool all the time. If your stool is thin like a ribbon, or you're constipated, or you have anemia, or you're losing weight without trying. You're not exercising, you're not doing anything, but you're losing weight. So having talked about those two cancers, we need to talk about the role of screening. When we say screening, it means you're going to hospital when you're not sick. I will tell you for a fact, 70 to 80% of the patients I see every day present late. By late, I mean the disease has already advanced. It's gone to other organs. And that is not just what is happening in Nakuru. Those are Kenyan statistics. You see, we're talking about most of them, 70%. So when we say you go for screening, it means you make time. You decide that I will go to the hospital today, afternoon, just to get checked. And what are some of the cancers we're talking about? The Kenyan guidelines talk about us screening for breast cancer, cervical cancer, colorectal cancer, prostate cancer, and sometimes even oral and childhood cancers. Those are cancers we can be able to screen, and it's important for us to do that. So the screening is guided. It is not just uncoordinated. It's based on the different cancers. So if it's breast cancer, primarily we start at the age of 40, where you need to have a mammogram done. So everybody who's 40 in this room, I hope after this talk will make a point to go get a mammogram done, so that we can be able to catch the very early signs of the disease happening. Then we have cervical cancer. We start from the age of 25 or 30. Colorectal cancer from around the age of 45. Lung cancer, if there's a high family history of lung cancer, we can screen, but we start almost at the age of 55. So how do we screen? There are different kinds. I already talked about the breast, where we do a mammogram. We talked about an ultrasound. For some women, we may need to do an MRI, just if the breasts are very dense. Then for colon cancer, we always want to do what is called a colonoscopy. So a colonoscopy enables us to see inside the colon, so that we can see any of the lesions that are in there. As you can see, there is a camera that is inserted through the rectum, and it will show us the whole colon. There's also what we can test using blood, which is the fecal occult blood, and we can start that very early from the age of 40. Then that's an example of the tumor one can see using the colonoscopy. So there may be no other symptoms that you have colon cancer except the colonoscopy seeing this. Because cancer is not painful when it begins. When you have pain, most of the time it is advanced. So it's important for us to do the screening so that we can catch it early. Then cancer of the cervix, maybe we need to discuss it a bit because it's number 2 among women. So the cervix is what closes the uterus, enables a pregnancy to remain within for 9 months. And then when it's time to deliver, it's the organ that opens up and allows passage of the baby to pass out. If you look at that image, it shows us what can happen to the cervix. What you see here is an example of a tumor that can happen in the cervix. So it's important to note there are many symptoms. The symptoms can include pain when having sexual intercourse. You may have a discharge. You may have spotting. And sometimes you may have no symptom. And the only thing the doctor will see is when they do perhaps a examination, then they see this lesion. Remember I said cancer is not painful when it begins. You only get pain when it's advanced. Other symptoms we can talk about, we're talking about weight loss, pelvic pain, loss of appetite, anemia. But note, these are signs that the disease has been quite advanced. So how do we prevent cancer of the cervix? We've talked about there are 3 things one can do. 1 is going for screening. 2 ensuring we are vaccinated or our daughters are vaccinated, and 3, ensuring we do not get into contact with the HPV virus. When we talk about vaccination, at least this is the one thing as oncologists we are very happy about, because it is one cancer we can prevent. There's so many cancers and we can't do anything about them. But the human papilloma virus that causes cervical cancer is something we can prevent, and there is a vaccine to it. In Kenya, we are able to vaccinate girls between the age of 9 to 14, because that really helps to prevent them from getting cancer of the cervix. HPV vaccination can also be given in boys. In the West, they vaccinate both girls and boys because HPV virus has been implicated for cancer of the throat, cancer of the penis, and other cancers of the oral mucosa. So it's important for us to consider vaccination even for boys. The vaccine is available. We can purchase it for our boys between the age of 9 to 14, and it's available within our hospitals. So thank you very much. I would invite questions, maybe if there are any, about cancer or anything I've discussed today. But thanks very much for listening. So any questions about cancer? Yes, I can see a hand there, kindly.
But mine is not a question, but it was a concern. It is a very good session, which we have learned a lot of things. But I'm afraid that we went so fast because of time, because we were just going through it. I don't know if I can request, or if do you have sessions somewhere else? Maybe if we find in church, maybe the time is limited, so that we can get more information. Because I can feel like there is something I want to know, to be discussed, so that, because honestly, I've lost most of my friends after realizing late when it is stage 4, stage 3. So you find us also men, when you have been told like you have been diagnosed with cancer and it is too late, tunaenda haraka sana, by the way. Our friends who never even finished even 3 months, they were told and they just went like that. So I feel like the way we used to do HIV and AIDS, we used to have a lot of long sessions, we talk, we discuss. But also in cancer, we really need to have time, so that also we can express ourselves as men. As you said, men, we don't want to discuss a lot, but it is good also we have that time. So I don't know how we can do it. Thank you.
So thank you very much. And yes, every time I do these presentations, the time is always going very fast, because I think there's not so much that is talked about cancer. There was one survey that was done, and it said even on telly, when they put a subject about cancer, the viewership is very low. I think people, if they hear the topic is cancer, they turn off the TV or go to another station. But like you rightfully said, it's important for us to have these discussions. Personally, I'm very passionate about talking about cancers, and I think we can arrange with the organizers of this session to see how we can have more sessions so that we can talk about each cancer. Because you're right, just going through an overview has not given us all the information about prostate cancer, has not given us all the information about colorectal cancer. But I think this was a sensitization to help us know, if I'm above 40 and I'm a man, what should I do? We need to check your prostate. We need to be sure you've had a colonoscopy. If you're a lady, you're above 40, you need to have a mammogram. We need to check from the age of 30 for cervical cancer. And for the parents in the room, we need to make sure our children are vaccinated, because we only have one major cancer we are trying to fight, which is cancer of the cervix. There are other cancers, there are cancer of the throat, that vaccinating your children will prevent them from getting it. So I think this was just a wake-up call to help us know we need more information about cancers, we need to go for screening, and if we do that, then we can ensure we have higher prevention Because some of the lesions that you find early, like for cancer of the colon, may just need a small operation when it's early. But if it stays for long, then we'll need many things. You may need the chemotherapy, you may need the radiotherapy. But I think one of the statements I always make when I make such a talk is we need to make sure we're not treating doctors and hospitals like police stations. Most of the time, we only go to the police if your car has been knocked, your house has been robbed. We don't just go to say hi. So sometimes it's good for us to change the narrative and go to hospital when you are well. Let us look for potential problems, because if we find them early, there is a lot we can do. Thank you. I don't know if there's any other question, but we will arrange for more sessions. All right, I don't see any hands, so thank you very much. You've been an amazing audience. Look forward to being here some other time.